Welcome to Min&Jean TV.
Now, we're talking, of course, about how different countries are tackling the virus, and South Korea has been widely praised for its response. They've seen 10,000 cases and 214 deaths. Still very sad, of course, but nothing on the scale seen here or in many other countries. So what is the secret to their relative success? We can talk now to South Korea's ambassador to the UK, Enna Park. Thank you very much for being with us today. Now, South Korea was one of the first countries to report a significant outbreak of COVID-19, but a relatively small number of people have died in the country compared to elsewhere. What lessons can others learn from South Korea?
Well, first, happy Easter to everybody. If I may, I'd like to start by paying tribute to all excellent, wonderful medical staff and volunteers who work very hard to save lives across the UK. And I would like to also wish the Prime Minister a very quick and full recovery on behalf of the Korean government and the people. Korea has successly made the curve flattened, but we know that it hasn't come to end yet, so we have to keep vigilant. But yes, Korean case seems quite successful, even though it is not the only perfect model for all other countries to follow, but we can share the lessons we learned. The main lessons we learned is testing is very important. So at the beginning of the outbreak, we encouraged medical research institutes to develop test kits, and we gave very quick approval, and we also promoted the Korean companies to produce test kit at a large scale. So we built up a stockpile, and it was the foundation of mass testing. So our strategy was test, trace, and treat, and it worked so far.
It's interesting, you tested over 500,000 people. That's around 200,000 more than the UK, despite having a smaller population. Do you think the UK should be testing more people?
So far, we have conducted more than 500,000 tests. So in terms of population per capita, Korea is the highest, the biggest testing country in the world. And, you know, early detection is very critical for right-time treatment. So early detection through tracing, we track down all suspected cases, all contacts of the confirmed cases, and we utilize the advanced technology, ICT technology like credit card transaction record, history, CCTV footages, and mobile phone GPS data. So we traced all suspected cases and all contacts, and we put those people into the right medical facilities for early medical intervention. That's how we had kept the fatality rate very low, around less than 2%.
Interesting to hear how important contact tracing has been, but you were there just saying, you know, that you've used CCTV, you've used GPS data from phones, you've used credit card transactions. Is there a concern there about privacy?
Well, of course, there has been concerns expressed. However, 5 years ago, when we hit by MERS, we introduced new laws to make tracing easier in case of a new outbreak of infectious disease. And the law stipulates to what extent we can collect information and how we can use it, what are the limits, and how we deal with those information to protect privacy. So we used the information to track down, but we made only relevant and anonymous information. We disclosed those relevant and anonymous information to the public. Okay. And we try to balance public health care concern and privacy. And people in Korea, they are willing to compromise their privacy to some extent in order for the sake of a great good, for the sake of public health. And I think that is civic awareness.
One other thing I want to ask you about is face masks, because many people in South Korea wear face masks to protect themselves and others from coronavirus. That isn't officially recommended in the UK. Do you think it should be?
Every country has different challenges and different background, so I can't say UK government should or should not, but the Korean government made the official recommendation to wear mask because based on our experience and our research, we know that the mask helps reduce the risk of being affected and also transmitting. Taking into account that there are many cases, confirmed cases with no symptoms. So you can spread the virus without knowing it. So we know that wearing mask, it doesn't completely prevent from being infected or from transmitting, but it helps.
OK, and just finally, I want to ask about quite a concerning story. Around 91 patients who were classed as being cured of coronavirus in South Korea have tested positive again. That's according to the Centers for Disease Control and Prevention. Does that mean that we might not get immunity for COVID-19, or does that mean that the tests are not reliable?
We are not quite sure, but the test itself is quite reliable, but we do not know enough about this virus. So after being cured and you are diagnosed that you are fully recovered, but still there is a possibility that the virus are alive in your body and is reactivated. So we are in the process of learning about the virus in a more complete way.
OK, and thank you so much for coming on the programme this morning, sharing some of the lessons that the world can learn from South Korea. Much appreciated.
Before closing, I'd like to touch upon one important issue, which is racial discrimination. Unfortunately, we witness some incidents of fear, xenophobia, or racial discrimination targeting Asians. And it's not acceptable, and we are living in a civilized world. This is time to show solidarity and support to each other. By doing that, we can overcome this pandemic.
Very important final message there as well, and something that I'm sure that we can all get behind. Absolutely right. Thank you.
Min&Jean TV.